Hi guys, it's Matt Riddell here, and I'm here with Dr. David Stephenson, who is our friendly dentist. Now, just a little bit on how I met David. It was actually at a networking group where he got up and spoke on the vision he had for his dental clinic, and I was so impressed that I gave him a call about a week later and said, "Hey, my name's Matt here. I'm from where we're from, and you'd already used our products, right?"
Yeah, that's right.
Yeah. So how did it come to be?
That was 3 years ago. You
Yep.
called me, and we had been already stocking the chlorine dioxide and toothpaste since 1993
Right.
at work
Right.
to give to the or sell to the patients.
Mm-hmm. And okay, so some of the questions that a lot of people would have is, like, as a dentist, how does this rate
As a dentist,
for you, like as an individual? What are your thoughts on the toothpaste and mouth rinse that we recommend people use?
well, the first thing is it works to do what it's supposed to do. So that's lots of on the TV, lots of claims from pharmaceutical companies about oral care products, killing 99.9% of germs, etc. Do they actually work to do what you want it to do? The answer to that is probably no. Like if normal toothpaste and normal antiseptic mouth rinse worked, then dentists wouldn't see tooth decay and gum disease and bad breath and stuff because the product would have worked. But yet the dental profession sees those sorts of problems every single day, and it's not getting any better, by the way. So
You're not seeing lots of healthy teeth.
So there's quite a large group of the population don't ever want to go to the dentist, don't go to the dentist. They rely on the home care products that they buy at the shop to do the job, but they don't end up getting the right result.
So, question for you before we go on to like why you particularly like this, because I must say when I made that phone call of like, "Hi, it's Matt here," a lot of people are a little bit closed to it, but I was surprised that David was like, "Yes, I know these products very well. Can you come and get me started? I've been, we had someone looking after us." And
because I'd been part of it, but had for some circumstances had lost my contact and needed to start up again. But the reason is because these things work for me. So
share that. That'd probably be a good spot to share.
okay, well, I'm a dentist. I know I'm supposed to brush my teeth, use toothpaste, and use probably Colgate toothpaste. I'm allowed to say that on a closed group.
Yeah, you can say it.
Most of my life, and found that when I did, it just made me choke and gag and cough and carry on for minutes and minutes afterwards, getting worse and worse and worse and worse with time. So around about 1993, one of my patients said, "Well, why don't you try the toothpaste?" So I did, and the next morning, or probably at lunchtime that day, I didn't choke and gag and cough and carry on. And I'm going, okay, fine, what's this all about? And she mentioned this stuff. I mean, I like to listen to the patients. There's a physician from the 1800s, Sir William Osler, says, "Listen to your patient because they'll tell you the diagnosis," which the medical profession, the health profession in general, should really adopt, because it's seriously true. You can learn such a lot from the experience, the health experience of the patient. So I treat myself as a patient. I notice that I don't cough and gag, and the reason is no sodium lauryl sulfate. Well, I didn't even know what sodium lauryl sulfate was.
You were taught about it?
No, because it's not written on the tube of Colgate, is it? So you don't know what's in it.
It's on the box.
So I wasn't even aware. So then I start to find out, well, quite a lot of my patients have the same experience. They don't brush their teeth properly because they can't handle the toothpaste.
You mentioned something to me, because we're friends. I mean, one of the conversations we had was about the whitening agents and the abrasives used in a traditional toothpaste. Like, I suppose there's a list of things you probably wouldn't want to have in a toothpaste. SLS being one. What's another one that you wouldn't want in a toothpaste?
Well, enamel on your tooth is very hard. We use diamond drills and tungsten carbide drills to try and cut it. So it will put up with a lot of punishment from abrasives. but it gets stain and stuff stuck to it, and you want to get rid of that. Okay. Well, sometimes soap, sodium lauryl sulfate, won't get rid of those stains, so we need a bit of grit to scour it. Well, we want to scour off the stain, we don't want to scour off the tooth. So you want something that's scratchy and abrasive, but soft.
Yep.
Pumice or hydrated silica, which is in the product. Not titanium dioxide, which is white mineral sand, which when you look at under a microscope is little tiny spheres, very, very hard ball bearings that they grind up very, very, very small so that you don't notice how abrasive it is.
Right.
So if you're chronically cleaning your teeth with titanium dioxide, you will get sensitive teeth, and then you'll have to buy their sensitive tooth product.
Right. Isn't that crazy?
Well, it's very clever, isn't it? If you want to sell more crap.
Well,
are you allowed to say crap on a close?
Well, you can say what you want. I like the cannabis, right? Okay, so you're saying the fact is it doesn't have the nasties and it's a big one, right? A lot of people are confused, and it's something like you use personally, yeah?
Yeah.
Because of the fact that it doesn't make you choke and gag.
Yeah.
The abrasive is...
Cleans my teeth.
Hydrated silver will clean your teeth without scarring them.
That's right. You want to cut and polish your car?
Can kids use it?
Of course.
Yeah.
Well, their enamel is still hard.
Yeah.
Not quite as hard as adult enamel, but still hard. Cool. If you want to cut and polish your car and shine it up on a weekend, fantastic. Would you do it every single day for a couple of years? You won't have any paint left.
Yeah. You don't cut and polish daily, right?
No.
Yeah. So can you explain, because I must say before, I'd used one of the store-bought ones that was alcohol and would exploded your mouth. Probably not the best idea with mouthwash to do that, right?
What are you trying to do?
Well, good question.
What are you trying to do with it?
I thought the purpose of mouthwash, isn't it, to get into all the spots that maybe the toothbrush missed?
What for?
Well, that's a good question. To kill the bacteria?
Do you want to kill all the bacteria in your gut?
No.
So what are you using your mouth rinse for? Really? You're going out for
breath.
You're going out. You want fresh breath.
Yeah, right.
You want healthy mouth that doesn't stink.
Yeah, that's good. I want a healthy mouth that doesn't stink.
Okay, you can sit this close to someone, you can't smell them.
Yeah.
Okay, so why would you use a product that is a weak antiseptic? It's not even hospital grade, so it's going to kill some germs, 99.9% of the ones they test the first time, but weak antiseptic breeds resistant germs. If you use it regularly, you're just going to breed resistant germs.
Right.
And so instead of having a nice healthy population of healthy germs in your mouth, you're probably going to knock them out fairly easily and breed pathogens.
Right.
Okay. So I see people with chronic gum disease who use Listerine daily. Well, if the Listerine worked, they wouldn't have chronic gum disease, would they?
Right.
Okay. So what are we actually trying to do? Nice healthy mouth that doesn't stink, right? Okay. Why don't we have an oxygenating agent? Because the oxygen cleans up the nitrogen and sulfur from the breakdown products and proteins and it deactivates all the anaerobes, oxygen hating bacteria, which are the ones that cause trouble. But it won't harm human cells, and it won't harm the oxygen loving cells.
So the good bacteria love oxygen, the bad bacteria don't like it, they're anaerobes, as in...
Yeah.
So if you oxygenate... So how does this work?
In a strictly very simple sense. That's the way it is.
So how does this work? Because a lot of people don't use... like I said, I didn't, but you explained this to me how to use it. I've used it ever since, and it's great.
Okay. You've brushed your teeth, you've flossed. That's just to remove the gunk, the plaque. Now what you want to do is change the film of bacteria that's in the saliva that's sitting all over the mouth. But saliva is fairly sticky. So put a little bit in your mouth, swish it all around, suck it between your teeth, put the toothbrush back in your mouth and start taking the saliva off your teeth and tongue and roof of your mouth and gargle and, brush your teeth, remove the saliva off your teeth and spit it out. Don't wash it off.
Right.
Leave the
Leave
oxygenating effect in your mouth so it can do some work over the next hour or so and change the biofilm of your saliva.
So it's completely safe?
Yeah. You can drink it. You probably wouldn't want to drink a lot of it because it's going to oxygenate the bacteria in your guts.
Right. So that's why some people who have got, like, say, feeling like a bit of an upset gut or something, and I've heard where people, drink a bit of it and they feel better, that would be why?
Well, the little tablets that you travellers use to sanitise water are concentrated chlorine dioxide.
Right.
It's used in industry and commercial applications, food applications. They put it in the water that chicken farms feed the hens, and they wash the eggs in it so you don't get salmonella. Basically, it works on organic debris much better than the pool chlorine chemistry.
Yep. Because people see chlorine and go, oh my gosh, that sounds hardcore.
It's a different chemistry.
Right.
And pool chlorine chemistry, if the pool's not going well, you need to put in more and more and more and more. You get to a limit of whether that's going to work.
Yeah.
Sometimes commercial pools have to bring in specialists who use a lower concentration of chlorine dioxide to clean up the Giardia, etc. that might be in.
So it's really effective on things like bacteria. You've said it before. Was it on bacteria or on
Giardia, viruses, parasites?
Just good
because
stuff.
it releases an oxygen molecule. So
changes the whole environment.
So
cleans up everything.
An oxygen atom. They're like ozone. Ozone releases oxygen, but it's very hard to create ozone in your mouth.
Yeah.
So you're oxygenating the mouth, but you're not harming anything else.
That's awesome. So just a quick one too, because I just want to conscious of time. But I hope you guys are finding this interesting, because I've had these conversations with you before. I'm like, we have to record this because I didn't know it. But most people don't know, and I'm most people. As far as nutritional supplementation goes, would you recommend people take things like a mineral supplement or like probiotics and stuff like that? Like, would you recommend that to people?
Yeah, I was listening to the John Ellison lecture about the probiotic.
Oh, John Ellerman, yeah.
Ellerman,
yeah,
that's right, about the probiotic, and he was saying, you get little capsules from the chemist and swallow them, and that misses the mouth and gets activated in the stomach and then goes to your gut, right? Well, the interesting thing about those sachets, I think, is that you put them in the water and throw them in your mouth. You are actually inoculating your mouth as well.
I didn't even think of that.
Yeah, and inoculating your mouth with good bacteria. Well, in the dental industry, it's a not well accepted product, because a not well shared product, but you can actually buy probiotics for the mouth.
Yeah, right. But you could actually just use that and swish it around.
Swish it around your mouth, swallow it.
That's awesome.
You just keep inoculating your mouth as well. I think that's one of the understated things about the probiotic, is that actually he says that he came up with 2 strains that do the entire gut.
Yeah.
But he forgot to say it
And
also
it starts at the top, right?
Starts
still
here.
part of your gut.
Yeah.
So I'm a huge, my little personal 2 cents, I'm a huge fan of mineral supplementation. Just to leave everyone on that, and what's your thoughts on...
All right, well, we're talking about saliva, right?
Yeah.
Saliva in itself is protective of the mouth, obviously. It protects the teeth, puts calcium phosphate into the teeth, it protects the gums, nourishes the gums, it's got lots of enzymes, it's got... it's alkaline, should be about pH 7.4. Very few adults that I test have saliva that's alkaline. Most of the adults walking around have acidic saliva. Well, acidic saliva breeds the sort of germ that likes to cause tooth decay and gum disease.
Right.
So, how do you alkalize your saliva? Well, you drink plenty of good quality water.
Yep.
And you need minerals.
But things like I know that, like, things like like your super greens and all that sort of stuff help by alkalizing as well. Minerals, super greens, all that sort of stuff actually helps your teeth.
Yeah, it creates better saliva. So if I've got someone with acidic saliva, I start talking to them about water, alkalinity, and minerals, because you can't have alkalinity without minerals.
Right.
Now,
That's interesting.
That is interesting. So if you found a person who just lived next to a glacier in some area and they were drinking the water out of some stream, they're probably alkalizing themselves and hydrating themselves with really good quality water. But Australia doesn't have good quality soil, and it doesn't even have all the trace minerals that you're supposed to get every single day in the soil. So how can it be in the food? We are a nation with low magnesium and low selenium for a start in the soil.
Yeah. So when people say I get everything from my food, you would contest that.
Well, you can't unless you're getting it from some soil that's grown with all those minerals in it.
I had breakfast with Dr. Dingle the other day, and he gave me this blank look of like, oh yeah, like same look you just gave me, which is you just can't, right?
No. And so I think the fact that the mineral drink provides you with colloidal, micronutrient minerals, easy as anything.
Yeah.
Actually tastes alright. It looks kind of funny, but it tastes
looks a bit funky.
It tastes fine.
No problems.
Is fantastic because you're going to dose yourself with some minerals to help the water that you're drinking stick and get into you.
That's great.
Acidic water will flow through you and suck all the minerals out of you.
Oh, great.
Alkaline water will put minerals into you.
Right.
Well,
so it's good to have filtered water with some minerals in it.
Brisbane tap water is pH 7 neutral.
Yep.
So you're going to drink it. It's not necessarily going to push too many minerals into you, is it?
No, but it's not going to. So it's a bit neutral.
It's neutral. It's made to be neutral. So if you could drink some normal mountain spring, granite spring water, it'd be alkaline.
Yep.
You need to get your hands on some clean, quality, alkaline, mineral-rich water somehow.
Yep.
You're either going to buy it or you're going to make it yourself.
Through like a mineral filter of some description.
Yeah, so at our work, we just have a pot where we tip Brisbane tap water into it. It filters it all.
Through mineral.
And then alkalizes and remineralizes it, and out the end comes good quality clean water.
Yeah.
And then takes a mineral drink with it, and suddenly you start to alkalize. It takes about a month or so, but you start to produce some good saliva.
It's marvellous. Guys, I hope you got a heap out of this. We'll leave it at that for today. No doubt there'll be other times when David will come on and chat with us.
No doubt there is so much more.
Oh, I know. Look, this guy's a world of information. I just love it in the conversations. And so many times I've gone, we've got to record this. So I really appreciate your time and appreciate the fact that you contribute to our group. I think everyone really benefits from that. So enjoy, guys.
Thank you very much.
Thank you.